Hello. Today what I'm going to talk to you about mental illnesses, because most of us, because it's something to do with the mind and because it's something to do with the thoughts, when there is something abnormal going on with the mind, we tend to think that we can control it with our mind. But the concept about mental illness, although most of the people do not understand it, it's very, very different. So today what I'm trying to do is to discuss some things so that hopefully you get a better understanding about what mental illnesses are. Let's go to something we all know, something like diabetes. What happens in diabetes? There is a gland in our body called pancreas, and the insulin hormone, which is secreted from the pancreas, is only secreted in reduced concentrations. So as a result, people might feel very thirsty, they would want to urinate more often. So those are the clinical things that come up with diabetes, and you have to treat diabetes with either insulin hormone or oral medications, and if it is not controlled properly, they might end up with complications like problems with the kidneys or the nervous system. So that's what happens. So if we look at mental illnesses using the same concept, although we feel it in our mind, it is actually something to do with the brain. There are neurotransmitters or chemicals in the brain like serotonin or dopamine, and when they are existing in reduced concentrations, you get what we call depression, or when there are other neurochemicals existing in different concentrations, you might end up getting schizophrenia or bipolar affective disorder. So this slide shows the changes that happen in the brain compared to the normal brain when there is schizophrenia or depression. That's why the different colors are there in different disease states in this slide. So what happens, let's take the example of depression. What happens in depression? So the serotonin, which is in the brain, is existing in low concentrations, and as a result people would feel very sad, they don't have energy to carry on work, and they might not have the usual interest in the pleasurable activities, they might have poor sleep, they would lose appetite, and if that is not controlled properly, they would get complications like psychotic symptoms or even ideas of harming themselves to the point of committing suicide. Though that's a complication, just like in diabetes, where if it is not controlled, they might end up with problems with the nervous system or the kidneys. So again, going back to diabetes, to control diabetes, you have to take the medications either as form of tablets or injections as the insulin, and it is backed up by exercise, dietary control, and regular screening for perhaps complications in the kidneys or the nervous system. So just like that, if we take the example of depression, you can treat depression with oral medications, and there are other several things that we can do. It can be backed up by cognitive behavior therapy. I mean, that is a form of talking therapy. And if we take something like schizophrenia, yes, the oral medications are there, and there are the injections that can be given if needed only, and then there is a place for rehabilitation. So again, like with diabetes, it's a multidisciplinary management. So I hope from this short video that you might have a better idea about what mental illnesses are.
I would like to thank Dr. Chathurie Suraweera, consultant psychiatrist of the University Psychiatry Unit of the National Hospital of Sri Lanka, for lending us her time and knowledge to educate you guys, the general public, about the basic concepts of mental illness. If you have any queries, any questions, that you can go to our Facebook page, Mental Health Roundtable, or subscribe or include in the comment section below. We hope to see you again with another video in the near future.